Um, Advancing Healthcare Awards, or Advancing Healthcare Awards, or AHA Awards, 2023, in around the category regarding the award for innovation in healthcare science. A nomination had been put forward on behalf of the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for kids. The nomination asked several questions. There were several sort of questions in and around the nomination. The first question was in this category in around the award for innovation in healthcare science. The award for innovation in healthcare science. Summarize your project and its significance. So, the RPSG, or the Renal Patient Support Group, the RPSG and the Kidney Disease and Renal Support Group, or KDARs for kids, are both evidence-based support platforms for pediatric and adult renal recipients in chronic kidney disease (CKD). The platforms have expanded internationally as the go-to place evidencing science across kidney care, public health, and research practice. The second question: describe the project more fully, including any relevant background work and supporting evidence. Both initiatives have focused on efforts surrounding and integrating healthcare and education. Retrospectively, both social media platforms have been implementing and following academic practices of those colleagues and peers to ensure rigor throughout kidney care practice. The RPSG and KDARs have progressed, and there have been publications, to substantiate according to pediatric and adult nephrology aligned to public health. The RPSG and KDARs initiatives have several evidence-based publications and website highlighting how different areas of science and nephrology and public health are amalgamated. Both the RPSG and KDARs were developed to ensure there is awareness surrounding kidney care. In linking patient and public involvement, or PPI, and educational initiatives, both the RPSG and KDARs extend its courtesy, inviting collaborations from undergraduate to postgraduate candidates to those across healthcare and industry. The RPSG invites researchers to co-develop CKD research and get involved. The RPSG is that place where awareness and research meet. The RPSG has over 10,000 members internationally and channels across 6 social media platforms. KDARs has near 2,000 members and has represented across various arenas, including International Pediatric Nephrology Association and the American Society of Nephrology. The next question in this nomination was how does this or could this benefit patient care? So to ensure evidence-based and benefit to patients, both the RPSG and KDARs have ensured there is several social media platforms, or there are several social media platforms that are used to integrate care for patients or service users, and a premise surrounding involving health professionals and academics to partner to involve lives around kidney care. Both the RPSG and KDARs have led patient and public involvement efforts in keeping with the National Institute for Healthcare Research, or NIHR, to support practice excellence across kidney care, ensuring patient-reported outcome measures support patient care. The next question in around this nomination, in around the award for innovation in healthcare science, was was what systems and policies are in place to sustain this achievement. Both the RPSG and KDARs have been implementing commitment to patient care over the last decade. The initiatives surrounding the NIHR standards, and according to service provision, where the NHS and kidney care practices are involved. Both RPSG and KDARs have been part of a solution to establish healthcare educational support remotely and across social media platforms. The patient public involvement mechanism, or the PPI mechanism, is important for inducing measurable quality of healthcare by allowing service users to share lived experiences to inform shared decision making. The systems and policies implemented have made both KDARs and RPSG the systems and policies implemented have made both KDARs and RPSG sustainable. The final sort of question in this nomination around the award for innovation in healthcare science is how could the approach be sort of utilized by other organizations? So the NIHR, the NIHR Patient and Public Involvement Framework, or PPI framework, has had a positive impact on service users. They've become more empowered, valued, listened, and more positive about lived experiences. Involvement allows more joined-up thinking between academia and healthcare to drive evidence-based healthcare. Both KDARs and RPSG have enhanced kidney care practices where scientific practices have also substantiated evidence base. The RPSG and KDARs have highlighted highlighted examples of initiatives that can be utilized or duplicated or replicated by other organizations and across healthcare. Both the RPSG and KDARs, like the NHS, ensure representation across ethnicity, race, diversity, and inclusivity to reflect scientific practice and commitment to patient care. This closes this overview in around the Advancing Healthcare Awards nomination overview in around the award for innovation in healthcare science. In around this overview, there will be a basis in around another nomination around the Advancing Healthcare Awards 2023, the AHA 2023. This nomination or this overview is in around the category under the Academy for Healthcare Science Award for inspiring the healthcare workforce in 2023. And wherein again the nomination surrounds or is on the basis of the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for Kids, England, UK. The initial basis in around this nomination and under this particular category under the Academy for Healthcare Science Award for inspiring the healthcare workforce in 2023 in the future, or 2023 is in around describe what the nominee has done and how it is innovative. So both initiatives have focused on efforts surrounding integrating healthcare and education. Retrospectively, both social media platforms have been implementing and following academic practices of those colleagues and peers to ensure rigor throughout kidney care practice. The RPSG and KDARs have progressed, and there have been publications to substantiate, according to a pediatric and adult nephrology aligned to public health. The RPSG and KDARs initiatives have several evidence-based publications and a website highlighting how different areas of science and nephrology and public health are amalgamated. Both RPSG and KDARs were developed or have been developed to ensure there is an awareness surrounding kidney care. In linking patient and public involvement, PPI, and educational initiatives, both RPSG and KDARs extend its courtesy, inviting collaborations from undergraduate to postgraduate candidates to those across healthcare industry. The RPSG invites researchers to co-develop CKD research and get involved. The RPSG is that place where awareness and research meet, and the RPSG has over 10,000 members internationally and channels across 6 social media platforms. KDARs has near 2,000 members and has represented across various arenas, including the International Pediatric Nephrology Association and the American Society of Nephrology. Under this category, aligned to the Advancing Healthcare Awards AHA 2023, and the category under the Academy for Healthcare Science Award in Inspiring the Healthcare Workforce in the Future 2023. One of the other bases is what has been the feedback and how has been evaluated? So patients or service providers want more understanding of health in a range of areas and require health professionals to be part of discussions where they can get more integrated care. The Renal Patient Support Group, the RPSG, and Kidney Disease and Renal Support, KDARs, for kids, are both evidence-based support platforms for pediatric and adult renal recipients. The platforms have extended internationally as the go-to and place evidence in science across kidney care, public health, and research practice. Feedback and evaluation have been through workshops, online polls, paper and poster publications, and wherein there is an effort to integrate healthcare aligned to electronic patient records, or EPRs. In around this category, aligned to the Academy for Healthcare Science Award for Inspiring the Healthcare Workforce in the Future 2023, there is a basis in around what measures have been taken to ensure the innovations, adaptability, and sustainability. So to ensure evidence-based and benefit to patients, both RPSG and KDARs have ensured there are several social media platforms, and there are several social media platforms are used to integrate care for patients, and premise surrounding involving healthcare professionals and academics to partner to improve lives around kidney care. Both RPSG and KDARs have led patient and public involvement PPI efforts in keeping with the National Institute for Healthcare Research, or NIHR, to support practice excellence across kidney care, ensuring patient-reported outcome measures support patient care. The systems and policies implemented have made both KDARs and the RPSG sustainable. In around another basis in this category, in the Academy for Healthcare Science Award and for Inspiring the Healthcare Workforce in Future 2023, and in around the AHA 2023, another basis is how far is it transferable to other units and departments. The RPSG and KDARs have highlighted examples of initiatives that are highlighted examples of initiatives that can be utilized by other organizations and across healthcare. Both the RPSG and KDARs, like the NHS, ensure representation across ethnicity, race, diversity, and inclusivity to reflect scientific practice and commitment to patient care. Finally, in around this category, or under this category, aligned to the Academy for Healthcare Science Award for Inspiring the Healthcare Workforce in the Future in 2023, under the AHA 2023 Advancing Healthcare Awards 2023. Another basis on the final basis in around this category, how has the innovation impacted on the department or service provided? So both the RPSG and KDARs are established to provide healthcare educational support remotely as part of service provision for those suffering with chronic kidney disease or CKD. The patient and public involvement mechanism, or the PPI mechanism, is important for inducing measurable quality of healthcare by allowing service users to share lived experience to inform shared decision making. This closes the sort of overview in around this basis in around the Advancing Healthcare Awards and the in around the Advancing Healthcare Awards, and aligned to works on behalf of where the nomination is in around the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for Kids England UK, and where this is under the category the Academy for Healthcare Science Award for Inspiring the Healthcare Workforce in the Future 2023, and wherein this is an overview aligned to, again, the Advancing Healthcare Awards 2023.